Health, exploring the silent connection. This session on BPSC. And to everyone watching this session today, Doctor has done his MBBS, MBA in Hospital and Healthcare Management, Diploma and Fellowship in Diabetology from RLA UK, MCDM, and Fellowship in Diabetic Food Management, and also the Fellowship in Diabetic Food Care. He is practicing at Dr. Arun's Diabetic and Diabetic Food Care Specialty Center, Mutandi Kupan. Dr. Arun Kumar will be sharing his insights for this particular topic. So, before proceeding further, Doctor, would you like to add something from your end?
Yeah, we can start the session.
Okay, thank you, Doctor. So, we'll start with the conversation. So, my first question to you is, how does hypertension affects the kidney?
Actually, hypertension affects all the blood vessels, and most probably the most deadly thing is it affects the kidney. As the duration of the hypertension increases, the more risk of getting more organ damage is more. And when it mostly affects the blood vessels, and the blood vessels in the kidney, which is glomeruli, is affected, which leads to excessive force in the small vessels, and that leads to thickening of the glomerulus, which is known as hypertensive nephrosclerosis, and which further damages the kidney function in filtering the excessive waste and the fluids in the body. And while the construction of the blood vessels is done by renin angiotensin system, which further increases the blood pressure, then the blood pressure increase leads to then construction of the blood vessel. It is like a cycle. The blood pressure increases, the blood vessels are more damaged in the kidney, where due to the damage of the kidney, the constriction of the blood vessels occurs, which further increases the blood pressure. So it's keep on going in a circle manner, and the prolonged increase in BP leads to the damage of the nephrons and glomerulus also, and the increased blood pressure in the kidney leads to leakage of protein in the urine, which is known as proteinuria, which is a early marker to identify the kidney disease. And the high blood pressure leads to decrease the perfusion, increase the perfusion in the kidney, which further reduces the glomerular filtration rate, and by impairing the kidney function, then in severe cases, the uncontrolled hypertension may also lead to end-stage renal disease, where the patient can survive only if he can go on dialysis or a kidney transplant, which further leads to impairment of the other electrolytes also, and fluid retention, which may lead to pulmonary edema and hyperkalemia and other congestive cardiac failure, and many things affects overall. And when the prolongation of the hypertension over the period may lead to further damage in all the blood vessels in the body, and along with the kidney there is also the problem of cardiac problems and retinopathy. Mostly everything is interlinked with the non-communicable disease, which was not being controlled by the patients nowadays.
Yes. Thank you so much, Doctor, for this detailed information. Because hypertension affects the it has a vast effect on
Yeah.
kidney, right? So, Doctor, my next question is: in a case, what is the effect of hypertension on kidney when a person has been diagnosed at a very young age as a hypertensive, but didn't take any blood pressure medications, the control medications, till very long time?
Yeah, you are asking the patient is not taking medication from the beginning of the diagnosis. Yeah,
Yes, yes,
most probably when we are diagnosing at young people, they will not be ready to take medication at early due to many myths and social dilemmas. The patient neglects to take medication unless they have some serious symptoms. So at the time when they are having a symptom, it's like they have a reached a problem in an organ, because these non-communicable diseases always end up in end organ damage. So the mostly the young person with the non-communicable disease will have more struggle to start medication than the older people. So when they are not on medication, microvascular injuries in the kidney occurs. Not only in kidney, all over the body, the microvascular blood vessels are affected due to the long standing of BP, which further decreases the kidney function and the filtration rate. And in initial period there will be hyperfiltration of the kidney, which leads to the hardening of the vessels, which is I already said it's sclerosis of the vessels. When the scarring of the vessel is occurring over the period, the filtration ability of the kidney is reduced, which leads to fluid retention and electrolyte imbalance and many other complications. And when the patient is diagnosed with proteinuria, which is a early sign of kidney damage, at least that time the patient has to go under strict blood pressure control. But most of the person will not have a basic knowledge regarding what to do, and mostly the myths of a social dilemma to start a medicine at a younger age leads to end organ failure, which when they are not doing it at an early stage, they will further worsen the kidney health also. And increasing the BP leads to sudden onset of kidney injury and retinopathy problems also. So mostly the patients who was in hypertensive has to go undergo proper investigation under a healthcare professional and required to do the proper blood test investigation on the necessary time interval. So taking medication does not affect any organ. Just increased blood pressure leads to damage of the kidney and the kidney function, and increased blood pressure eventually over the period leads to end organ damage. When we are coming to younger people, they have to live with the disease for longer duration. So if they are not controlling their blood pressure at the early stage, they may end up with a very severe complication, not only with the kidney, everything.
Yes. So, doctor, will the same effect if that person takes the medicine irregularly in an irregular manner?
Yeah, the same thing. The At the end they have to have the blood pressure under control, where which is the normal control. They should first realize it. The normal level of the blood pressure is, the systolic is 130 and diastolic is 80, and it has to be maintained below 140 to 90, which most of the patient neglects. As they saying, as I have a blood pressure of 160 and 100, I take medication for few days and it is reduced over the period to 150 90. So it's okay, it is reduced, I'm stopping the medication. They will be on irregular medication as usual.
Yes.
They won't have any initial symptoms. So due to lack of symptoms, they will not take the medication regularly. So if anyhow the prolonged variability in the blood pressure leads to end organ damage. So if they are not on regular medication, it will further, what will happen, they will have a kidney damage, just they are prolonging the time. So if the blood pressure is under control, they will not have any problem. If the patient who is not ready to control the blood pressure and who is not on regular medication, yeah, most of them now they are starting the medication over the period. They will check the BP at some centers, and when it is under normal while medication, they'll stop the medication for a few months, and again when they have go for a checkup, they'll start medication. So this what leads to the damage in the kidney, which leads to hypertensive nephropathy, which is a sudden onset, and it may even end up at end stage renal failure at a very young age, where the patients who are on hypertension and taking medication has to go regular blood investigation and check for their glomerular filtration rate and creatine function to prevent the further damage to the kidney. And end they have to take the medication. If they are on irregular, they uh, just prolonging the inevitable. They will at the end of the stage they will go to dialysis and suffer a lot.
Yes, that's why I guess there are two kind of myths in this case that many people think that the hypertension is an elderly disease, not a
Yeah,
young person
yeah,
disease.
most of the persons will not accept that they are having hypertension. They will
Yes,
say, I am not stressed, I am not tensed, even my family does not have hypertension, they does not have diabetes, it's not possible for me to have, I don't have any symptoms, why should I take medicine? It doesn't matter. If you are having hypertension, just take a proper lifestyle modification, take the proper medication, control your blood pressure level and blood sugar levels. They will have a healthy life. If the that that acceptance takes times, more education is needed. The patients will not do anything just by saying that you have BP, take the medicine. They need the proper education for them to be guided.
yes, definitely. Thank you, doctor. So my next question is, what are the risk factors or some parameters to understand if a person is at a high risk of kidney damage if he or she is a hypertensive?
Okay, the risk factors for hypertensive are lot. Most of the organs will be affected in hypertension, such as kidney, heart, and eye, brain, where they will have a stroke like symptoms. They will even have a severe stroke, and they may lose their sensation over the limbs, hands and foot. And some patient may have a heart problem, and some may develop a kidney problem, renal diseases, where over the period most of their organs will be damaged. So their most commonly we can prevent every upcoming problem in non-communicable disease is proper through checkups. So if they are going to have a problem in their kidney, they freely it will be shown as a proteinuria, increase the serum creatinine level, and reduce the glomerular filtration rate. Everything can be priorly diagnosed and treated at a early stage to prevent dialysis and very end stage organ failures. So a person who is hypertensive, so have to go undergo regular blood pressure checkup, serum creatine level which should be under normal, and glomerular filtration rate should be more than 90 for a normal kidney function. And checking the urine, which is very difficult to make the hypertensive patient to do. They will say I am doesn't have a sugar, because the myth among the people is sugar, only sugar patient needs to do urine test. No, BP patients also have a proteinuria which can be diagnosed at a early stage, and just a small urine dipstick method, and which it is a early the marker for the kidney failure, which we can identify it and start treating it early to prevent the end stage problem. And have to have a constant value of maintaining the sugar level, hypertensive level. So blood pressure should be maintained below 140 and 90 over always over the period, to avoid the variability among the BP. The more variability among the blood pressure over the day will leads to more progressive towards the kidney failure than compared to those who has maintaining their blood pressure. So if it is rising and lowering irregular medication, the person who is on irregular medication will have more variability compared to those other patients who are on medication or not on medication. So they have to maintain their blood pressure over the time in the proper control level. And older people, the very old age people who has uncontrolled hypertension, may leads to sudden progression in the kidney failure at the till end stage due to the age related changes in the kidney function. As the over the period, we see the persons who are diagnosed at very younger age will have to go with the disease for very longer period, so they will have a more organ damage than compared to other persons. But when it comes to older people, the already their organs are the age related changes will be there. So if they have a uncontrolled hypertension or other non-communicable diseases, it will further leads to the sudden onset of acute kidney injury, and very poor prognosis will be there. And we have to check for the other comorbidities like diabetes, dyslipidemia, metabolic diseases, and obesity, and all these other diseases also compound together in damaging the kidney, where the not only hypertensive affects the kidney, the blood pressure also affects the kidney along with diabetes, where uncontrolled blood sugar level, obesity, dyslipidemia, and many other factors compounds together in affecting the kidney problem. And the mostly the main problem among hypertensive is, along with comorbidities, they also have few lifestyle problems which are the case for renal failure, where the high salt sugar, sedentary lifestyle, where they lack of more physical activity, which further leads to increase in BP and decrease the kidney health, and low fiber diet, which also leads to increase in BP, and the patient who is alcoholic, smoking, that all together the lifestyle of their patients also leads plays a vital role in maintaining the kidney health and overall the patient lifestyle. Uh, and elevated electrolytes such as potassium and phosphorus, uric acid may also leads to kidney failure. So we have to maintain the proper level in all the things, including the electrolytes level, blood pressure level, sugar level, and their 3 months A1C level, and urea, creatinine, including the lipid profile. Everything should be maintained in the normal range. It will prevent the end organ damages. And the recently most uh, common abuse is being done is painkiller abuse, which is the most common cause of kidney failure among rural area people, where the patient may be hypertensive or diabetes. They go and take some painkillers, unprescribed counter sales at a cocktail like steroid like things are being given at the medical shops, where the patient takes is on daily basis. I'm seeing a few patients who are taking daily basis painkiller shots at a medical shop, which is also a main cause for kidney failure. The unwanted use of painkillers, NSAIDs, may also lead to kidney failure. So better to avoid this few 10 to 15 rupees expense than going to lakhs of dialysis and kidney transplant like expenses. And not only the kidney failure, it may also leads to cardiovascular symptoms, cardiovascular diseases such as cardiac failure and pulmonary edema, which may be life threatening at the patient who is on dialysis, and it also leads to stroke due to increased BP at the end stage of kidney failure. So to avoid all these risks, we have to do just go for regular follow up, meet a healthcare professional, and get their guidance to control your blood pressure. Not only with medication, with the proper lifestyle management, we have to go with the low salt foods, avoid unwanted junk foods, take proper exercise over the period of 30 minutes per day, 250 minutes per week. So seeking a proper health advice from a healthcare professional by nearby hospitals prevents lots of end organ damage. Then seeing it in a just anything and reading over the WhatsApp or just going to the medical shop and spoiling the health. Better go to a healthcare professional to have a better life than ending up with the end organ failure such as dialysis and anything. And at the end, the patient has to have a blood sugar on and blood pressure under control with medicine and lifestyle modification. Nothing can be done if the patient is at the early stage. If they don't know, it's okay. But after realizing that they have some problems, they have to have a strict control, because everything can be prevented if it is early. Always you used to say prevention is better than cure. So we can prevent the renal failures just by controlling their blood pressure at the early stage.
Yes, I guess we have a good conversation and a discussion on the crucial topic for today. So lastly, sir, do you have any message or advice from your side to our audience apart
Yeah,
from
there
what
are
we have
lots of
discussed?
myths among the younger people today. That previously I spoke, it's not that I don't have any symptoms. Yeah, majority of the persons will not have any symptoms when it comes to non-communicable disease. So when they are having a symptom, it's just like their organ is already affected. So unless if you are not diagnosed, check it after the age of 20. It's checking a BP once in a while. It does not change anything. If it is we have a higher BP, can take medication or have a lifestyle modification at the early stage to reverse it. So better than not accepting what we are having, then we can go under prevention protocol from the beginning. And the myth is among the people is taking medication may lead to their organ failure. There are medications that should not be taken regularly. That is not the hypertensive medication or heart medication or the diabetic medication. That has to be taken regularly to prevent their organ failures. So all I wanted to say is taking the proper medication under a proper guidance does not affect your body. Using unprescribed medication on the counters will definitely affect the body.
Yes, definitely, doctor. Thank you so much, doctor, for this valuable and the insightful session. You have also discussed various important things in this conversation. And also to everyone, hope this session is fine, informative for you all. And I request all the viewers to follow BPIC on social media for more such informative sessions. Dr. Arun Kumar, once again, thank you so
Thank you.
much for joining with us. Have a nice day, sir.